What if I told you that one of the most common health conditions after the age of 50 can quietly develop for years without causing any obvious pain, and by the time many people discover it, it may already have started affecting their eyes, their kidneys, their heart, and even their nerves? The surprising part? Your body usually gives you warning signs long before serious complications develop. The problem is that those warning signs often seem so ordinary that they're mistaken for normal aging, or simply dismissed as part of a busy life. Today I'll show you the silent signs that may suggest your blood sugar is higher than it should be. More importantly, I'll explain why these changes happen, what they could mean, and when it's time to speak with your healthcare provider. Because when you understand what your body is trying to tell you, you give yourself the best opportunity to act early and protect your health for years to come. Perfect. Let's begin. Hello and welcome to Health After 50. I'm Dr. Tina Price, and here we believe that growing older doesn't mean settling for poorer health. Our goal is simple: to help you understand your body through clear, practical, evidence-based information you can use in everyday life. Before we begin, it's important to remember that none of the symptoms we'll discuss today automatically mean you have diabetes. Many common health conditions can cause similar symptoms, but when several of these changes happen together, or when they become more noticeable over time, they're worth discussing with your healthcare provider. Remember, this video isn't about diagnosing a condition. It's about helping you recognize when your body may be asking for a closer look. So let's begin with one of the earliest warning signs. Have you noticed you're drinking much more water than you used to? Perhaps you never leave home without a bottle of water, yet somehow your mouth still feels dry. Most of us would blame warm weather, exercise, or simply forgetting to drink enough. Sometimes that's true, but persistent thirst can also be one of the earliest signs of high blood sugar. Here's why. When glucose builds up in your bloodstream, your kidneys work harder to remove the excess. To get rid of that extra glucose, they produce more urine. But glucose doesn't travel alone. It pulls water out of your body with it. The more water your body loses, the thirstier you become. Many people think, if I just drink more water, this problem will go away. But if high blood sugar is causing your thirst, drinking more water replaces the fluid you've lost. It doesn't solve the reason you're losing it in the first place. That's why persistent, unexplained thirst deserves attention, especially if it's something new. Imagine Susan, who's 64. Over the past few months, she noticed she was refilling her water bottle constantly. She assumed it was simply because the weather had become warmer. Then she began waking up during the night needing the bathroom. Only after a routine health check did she discover her blood sugar was much higher than expected. Looking back, she realized her body had been quietly giving her clues all along. Stories like Susan's are common because these early signs often seem harmless when viewed one at a time. And that brings us naturally to the second warning sign, because the more fluid your body loses, the more often you'll probably find yourself making another trip to the bathroom. Why am I waking up several times every night? Does this sound familiar? You finally fall asleep, only to wake again and again, just to use the bathroom. Many people assume that's simply part of getting older. Sometimes it is, but not always. As we discussed a moment ago, when your body is trying to remove excess glucose, it also loses more water. One result is increased thirst. Another is that you may need to urinate more often, especially during the night. The result? More interrupted sleep, less restful nights, and often, much less energy the following day. Many people think the problem is simply waking up to use the bathroom, but in some cases, those frequent trips are actually a clue that your body is working hard to manage excess glucose in the bloodstream. That's why it's important not to ignore a change that's new, persistent, or happening alongside other symptoms we've discussed. Of course, frequent urination can also be caused by many other conditions, including drinking large amounts before bedtime, certain medications, urinary tract infections, an enlarged prostate in men, an overactive bladder. That's why it's so important to look at the overall pattern rather than focusing on one symptom in isolation. If you're experiencing persistent thirst, frequent urination, and some of the other warning signs we're discussing today, it's worth speaking with your healthcare provider. And those interrupted nights often lead to another symptom that many people simply accept as part of getting older, feeling tired all the time. Let's look at why that happens. So far, we've looked at two early warning signs: feeling unusually thirsty, waking up several times during the night to use the bathroom. While those changes can be frustrating on their own, they often have another consequence that many people don't expect. Have you ever slept for 7 or 8 hours, yet still woken up feeling completely exhausted? Many people assume that's simply part of getting older. But what if there's another explanation? Let's look at why that happens. Why am I so tired all the time? Have you ever reached the middle of the day and felt as though someone had switched off your energy? Simple, everyday tasks suddenly feel like hard work. You wake up tired, you stay tired. And by evening, you're completely drained. Many people tell themselves, "I'm just getting older." While aging can bring changes to your energy levels, constant exhaustion isn't something you should simply accept without asking why. Here's what may be happening. Your body's cells rely on glucose for energy. Think of insulin as a key that unlocks the door, allowing glucose to move from your bloodstream into your cells. When that process doesn't work properly, glucose builds up in the bloodstream instead of reaching the cells that need it. Imagine your home has plenty of electricity available, but a faulty switch prevents it from reaching the lights. The power is there, but the room stays dark. High blood sugar can work in a very similar way. There's plenty of glucose in the bloodstream, but your cells can't use it efficiently. That's one reason why many people with persistently high blood sugar feel tired, sluggish, or lacking energy, even after what seems like a good night's sleep. Of course, tiredness can also be caused by poor sleep, thyroid problems, anemia, depression, or many other medical conditions. The important message is this: if fatigue has become part of your everyday life and you can't explain why, don't ignore it. It's worth discussing with your healthcare provider. By now, you may have noticed a pattern. High blood sugar doesn't just affect one part of the body. It can affect several systems at the same time. Earlier, we looked at how it can leave you feeling tired and lacking energy. Now let's look at another area many people don't expect: your eyesight. Why does my vision keep changing? Have you ever cleaned your glasses, only to discover they weren't the problem? Some days your vision seems perfectly clear. Other days, the words on a page look slightly blurred. You might assume you simply need a stronger prescription. Sometimes that's true. But changing blood sugar levels can also affect your eyesight. Here's why. The lens inside your eye contains water. When blood sugar levels rise, they can change the movement of fluid into and out of that lens. Even small changes can temporarily affect the shape of the lens, making your vision seem blurry or inconsistent. Some days, everything may look perfectly clear. On other days, reading a book, looking at your phone, or recognizing a road sign may suddenly become more difficult. Some people assume they simply need a stronger pair of glasses, when the real issue may be changing blood sugar levels. That's why, in some cases, eye care professionals recommend waiting until blood sugar is stable before updating a glasses prescription. It's a reminder that your eyes don't work in isolation. Sometimes they can reflect what's happening elsewhere in your body. It's important to remember that blurred vision can also be caused by cataracts, glaucoma, age-related macular degeneration, or several other eye conditions. So don't assume the cause. Instead, arrange an eye examination and discuss any sudden or persistent changes in your vision with your healthcare provider. Your eyes aren't the only part of the body that can reveal what's happening beneath the surface. The next warning sign often appears somewhere many people don't expect: in the way your body heals. Before we continue, can I ask you something? Which of these symptoms surprised you the most so far? Was it the constant thirst, the tiredness, or the changes in your vision? I'd genuinely love to hear from you, so let me know in the comments below. And if you're finding this video helpful, please take a moment to give it a like. It really helps YouTube share this information with more people who may benefit from it. If you're new to Health After 50 and you enjoy clear, practical, evidence-based health information designed especially for adults over 50, I'd love to welcome you to the channel. Consider subscribing so you don't miss future videos. Now let's continue, because the next warning sign often appears in something most of us hardly think about: the way our bodies heal. Most of us don't think twice about a small cut, a scratch, or a blister, until one day it doesn't seem to heal the way it used to. Why would something so small take so much longer to recover? Let's take a closer look. Why are my cuts taking so long to heal? Think about the last time you had a small cut, a scratch, or even a blister from a new pair of shoes. Did it seem to take longer to heal than it once did? Your body is constantly repairing tiny injuries. In fact, it's doing it every single day without you even noticing. It's a remarkable process, but persistently high blood sugar can make that repair work much more difficult. Here's why. Over time, high blood sugar may damage the tiny blood vessels that deliver oxygen and nutrients to your skin and other tissues. It can also make it harder for your immune system to respond effectively. As a result, even small cuts, scratches, or blisters may take longer to heal and may be more likely to become infected. Healing isn't simply about closing a wound. Think of it like repairing a damaged road. The repair crew needs materials, equipment, and workers to arrive on time. If those supplies are delayed, the repair takes much longer. Your body works in a similar way. When oxygen, nutrients, and immune cells can't reach an injury efficiently, healing slows down. That doesn't mean every slow-healing wound is caused by high blood sugar. Poor circulation, certain medications, and many other medical conditions can also delay healing. But if you've noticed that cuts, scrapes, or sores consistently take longer to heal than they once did, it's worth mentioning it to your healthcare provider. Sometimes the body sends warning signs through the way it heals. Other times, it sends them through the way it feels. And the next symptom often begins with a sensation that's easy to dismiss: a tingling, burning, or numb feeling in the feet. We've now looked at 5 important warning signs, but the final 2 are often the easiest to overlook. One begins with an unusual feeling in your feet. The other can leave you wondering why you're still hungry, even after eating a satisfying meal. Both are easy to dismiss, but both deserve your attention. Let's take a closer look. Why do my feet tingle or feel numb? Have you ever noticed a tingling, a burning sensation, or a pins and needles feeling in your feet? Perhaps it only happens at night, or maybe your feet feel strangely numb when you first get out of bed. Many people assume it's simply poor circulation, or just another part of getting older. Sometimes that's true. But persistently, high blood sugar can also damage the small nerves, especially in the feet and lower legs. This is known as peripheral neuropathy. Here's why. Healthy nerves rely on a good blood supply to receive the oxygen and nutrients they need to function properly. Over time, persistently, high blood sugar can damage the tiny blood vessels that nourish those nerves. As a result, the nerves may stop sending signals normally. Many people think numbness means they'll notice a problem more easily. In reality, it often means they'll notice less, and that's what makes it so important. If you can't feel a blister, a small cut, or a sore on your foot, you may not realize there's a problem until it has become much more serious. That's one reason why regular foot checks are so important, especially for people living with diabetes. If you notice persistent tingling, burning, numbness, or any other change in sensation, don't ignore it. Your healthcare provider can help identify the cause and decide whether further assessment is needed. The final warning sign often leaves people scratching their heads because it doesn't seem to make sense. You eat a meal, you feel full, and then before long, you're hungry all over again. Why does that happen? Let's find out. Why am I always hungry? Have you ever finished a meal only to feel hungry again a short time later? You pause and wonder, how can I still be hungry? I only just ate. It doesn't seem to make sense. But as we discussed earlier, when your body's cells can't use glucose efficiently, they may not receive the energy they need. That same process can also affect your appetite. Imagine a supermarket filled with food, but every entrance is locked. The food is there, but nobody can get inside. Your body's cells can experience something similar. Even though there's plenty of glucose in the bloodstream, the cells may still struggle to access the energy they need. As a result, your brain may respond by sending stronger hunger signals, encouraging you to eat more. That's why high blood sugar isn't simply about having too much sugar. It's also about how effectively your body is able to use that sugar. Of course, feeling hungry more often doesn't automatically mean your blood sugar is high. It can also be influenced by physical activity, certain medications, stress, hormonal changes, or other medical conditions. But if increased hunger is happening alongside several of the other symptoms we've discussed today, it's worth mentioning it to your healthcare provider. What should you do if several of these signs sound familiar? First, don't panic. These symptoms do not automatically mean you have diabetes. Many other medical conditions can cause similar changes. But if you've recognized several of the warning signs we've discussed today, the most sensible next step is to arrange an appointment with your healthcare provider. A simple blood test, such as an HbA1c test or a fasting blood glucose test, can help assess whether your blood sugar is within a healthy range and whether any further assessment is needed. One of the most encouraging things is that identifying high blood sugar early can make a real difference. The earlier the cause is identified, the sooner you and your healthcare provider can decide on the most appropriate treatment and help reduce the risk of complications. That's why paying attention to these early warning signs is so important. Seeking medical advice early isn't about expecting the worst. It's about giving yourself the best opportunity to stay healthy for years to come. Your body is remarkably good at communicating with you. The challenge is that it usually whispers before it shouts. A little more thirst, a little more tiredness, a few extra trips to the bathroom, slightly blurrier vision, or a cut that takes longer than usual to heal. On their own, these changes may not seem important, but when several begin to appear together, they can become a message worth listening to. Looking after your health isn't about living in fear. It's about noticing changes, asking questions, and giving yourself the opportunity to act early when something doesn't feel quite right. If you found today's video helpful, please give it a like. It helps more people discover this information and could encourage someone to recognize an important warning sign sooner. If you're new here and you'd like more clear, practical, evidence-based health information designed especially for adults over 50, I'd love to welcome you to the Health After 50 community. Simply subscribe and turn on notifications so you don't miss future videos. And before you go, I'd love to hear from you. Which of today's warning signs surprised you the most? Share your thoughts in the comments below. You never know. Your experience could be exactly what someone else needs to hear today. Until next time, remember this: your body whispers before it screams. Learning to recognize those whispers today could help protect your health for years to come. Thank you so much for watching, and I'll see you in the next video.